We at St. Tammany Health System often talk about education, screening, and prevention. And today we're going to talk about a couple of ways you can do that and how we can help you do that. So joining me, first of all, is Dr. Brandon Bruce. He is a gastroenterologist with the Gastro Group and Endo Center in Covington. And we're going to be talking about Colorectal Cancer Awareness Month, which is in March. So we definitely want to talk about this topic because, Dr. Bruce, you know, at the beginning, first of all, welcome and thanks for being here.
Of course, thanks for having me.
Yeah. So at the beginning of the year, we heard news outlets reporting that colorectal cancer incidences in younger people is on the rise. Mm-hmm. You know, those statistics came through several places, one of them being the American Cancer Society. So we know that colorectal cancer, you can do some screening things, you can do some prevention things. So we just kind of want to elaborate on that and talk about how we can do that. So first, let's talk about what is it? What's colorectal cancer?
So colorectal cancer usually involves cancers of the colon and of the rectum. That's primarily what we're looking for when we do things like colonoscopies or other non-invasive testing and stuff. Big thing why we want to look for it is it's one of the most diagnosed cancers in the U.S. and it's actually one of the leading causes of cancer deaths in the U.S. as well. Fortunately, I mean, we've had pretty good screening modalities, and we've actually seen over time that the incidence of colon cancer has decreased over time in older populations. But like you alluded to, we have noticed that younger people are now getting colon cancer at earlier ages, and that incidence is actually rising. It rose about 2% over the last couple of years back then. So that's why the U.S. Preventive Task Force and the American Cancer Society actually pushed to decrease that age of screening to start at age 45 instead of age 50 like it used to be.
Gotcha.
And I think there's been a little bit of catch up. A lot of people still come and see me and they say, well, I didn't realize I was supposed to come in at 45. I thought it was 50. So that's why we're really trying to make a push to get that education out there for people so that they understand that, hey, we really ought to start looking at this at a younger age.
Sure.
Try and catch things before they become a bigger issue. Because we do see that with colorectal cancer that if we catch it at an earlier, more localized stage, your outcomes are much better than once we start getting down the road. And unfortunately, when things spread, it makes it much more difficult to manage.
Yeah. So like we were talking about that, you know, the earlier screening age, and that is your screening colonoscopy, which is generally covered by your insurance, correct?
Correct. So just about every single insurance company out there gives you a screening benefit that basically covers your colonoscopy starting at age 45. Mm-hmm. Now, we do have some non-invasive testing out there too for people that are concerned about that. So these are all things that you can kind of discuss with us or with your primary care doctor. Okay. But the important thing is getting some kind of screening at age 45, and any colon cancer screening modality should be covered starting at that age.
Okay, so let's talk about the younger population, say under 45, which we're hearing reports about the increase in. What are some symptoms, I guess for anybody really, not just the younger population, what are some symptoms that maybe I would see or someone would see that would raise a red flag and have them call their primary care or call you?
Sure. So there are certain red flag symptoms we look for in anybody. So things like bleeding. Most people attribute this to things like hemorrhoids or something just kind of happened that it went away on its own. That could be the first signs of it. It may just be as simple as hemorrhoids, but we can't tell you for certain without investigating it further. So that's an important thing to ask about. Iron deficiency anemia, which is a common problem, especially in males. Iron deficiency needs to be worked up at any point just to kind of figure out what's going on there. Changes in bowel habits are important. So if you're one way and then all of a sudden you're noticing things are kind of different in the bathroom than they used to be,
right,
that can be a sign. It could be just a temporary thing, but certainly if it's ongoing, it's something that needs to be worked up. And then things like family history are important as well. Okay. So family history does change the timing of it depending on first-degree relatives that have been affected and what age that they were affected at and such. So it's important if you have those risk factors that you go talk to your primary care doctor, because even without those red flag symptoms, unfortunately, we find some asymptomatic patients that are developing problems or having issues, and we go and we need to go look. So it's important for any of those things that pop up that you discuss with your provider, or we're happy to talk with you about it.
Sure. So a lot of the things, colorectal cancer, all the things that happen with bodily functions, it can be intimidating to talk to anyone about it.
Sure.
But what can you say to people just to kind of calm their fear of, say, embarrassment, or I don't want to talk about it, it's embarrassing, and they're going to judge me or whatever. But what would you say to people?
So I'd say the biggest thing, obviously nobody likes to discuss these things. It's kind of within our social norms not to discuss this. It's considered uncouth, but that's why we're here, is to discuss those things. That's why me and my partners, we've trained years and years to discuss this stuff in a professional manner, and that this isn't something to be embarrassed about. This is something that everybody does and everybody has to go through. So Shirley, I know it's hard to kind of get over that hump, but truly, we're here to help you. And I think that's the most important thing, is realizing that this isn't something to be embarrassed about. This is something that's important. And honestly, the little bit of embarrassment you might get now could potentially save your life in the long run.
That's the bottom line. It could save your life. It's a health issue.
Exactly.
So we talked a little bit about some of the things that you can do for screening. So let's talk about the recommended screening tools. Of course, the colonoscopy. So we talked about this before we started taping.
Yep.
I have a friend who's about to have her first colonoscopy.
Sure.
And she's like, what do I expect? So I had my first colonoscopy a few years ago. Terrified, as far as, I was more terrified of the prep than the actual procedure.
Correct.
And it turned out it was no big deal.
Yeah.
Really. So can you talk about what the colonoscopy is? What's the procedure?
So
What should people expect?
there is a little bit of legwork, like you talked about, but overall it's a pretty easy process in general, I'd say. Day before your procedure, you have to be on a clear liquid diet that day. So it's not quite the best diet, but you can still have some stuff. You can have Jell-O, broth, popsicles, snowballs even, black coffee without creamer, anything basically that you can do. And most people often ask me, can I work that day before? And I tell them that if you're okay to work on a clear liquid diet, then that's okay. You can go to work that day. That evening is when you'll do your prep. We do have a number of options out there these days. I know everybody thinks of the giant jug. That's kind of intimidating,
right.
But that's certainly one of the choices. But we do have some other options, like some smaller volume preps or some pill preps. Ultimately, I tell people all roads lead to Rome, just different ways of getting there. But you will have to clean out, because the next day when you come in for your procedure, we are putting a camera inside of you to look. So if we don't have good looks, then we're not going to be able to see what we need to.
Gotcha.
So I know it's a little bit of legwork, but in the long run, it benefits you. Next day, you'll go to wherever your procedure is being done at, either at a hospital or an ambulatory surgical center. You will need somebody to drive you, because you do get sedation for the procedure if you choose. I do have a few people that choose to do it unsedated, but I'd say the majority of people want to be sedated for their procedure.
Yeah.
We use a medicine called propofol. It's a very easy sedation. It's very fast on, fast off. We always have a CRNA that's there that's administering the medication. We're watching their vitals throughout the procedure. No breathing tube involved. It's just a nice, peaceful nap. You're breathing on your own. Most people say it's the best nap of their life. While they're asleep, though, we take a long, flexible tube with a light and a camera on the end. It goes up your bottom. It goes all the way to the end of the colon, and sometimes we'll go into the end of your small intestine.
Okay.
And then on the way out, we look for anything abnormal we need to biopsy or take out. And depending on that, we tell you when we would like you to come back for surveillance.
Gotcha. So about how long does the procedure take once you are sedated and it starts from start to finish?
On average, about 20 minutes or so, give or take a little bit of time. It also depends on things like your personal anatomy. We're all made a little different.
Sure.
Or if we do find something that we have to intervene on. But I'd say on average, most people should expect to be in their procedure for about 20 minutes or so.
And really the discomfort is on the front end as far as the prep.
Yep.
Once it's over, go have breakfast, pretty much. Right?
Exactly. That's what I tell everybody when they come in to see me. I tell them you've been through the worst of it. Now you just get a good nap, wake up, have your procedure done, and then pick out something, dream of something good to eat after.
Gotcha. Okay, perfect. So we're going to briefly talk about another screening option, which is a FIT kit. It's an at-home test, but just briefly touch on it and tell folks about that.
Yeah, so FIT, it stands for fecal immunohistochemical testing, which it's a lot easier to say FIT, of course.
Yeah.
But basically, these are some non-invasive screening modalities. FIT's the only other first line of screening that we recommend. So it's FIT test or colonoscopy.
Okay.
And basically it's a test, like you said, you bring home, so you don't have to go sit in a lab and try and do this in front of somebody or
Right.
anything. Bring it home, they give you instructions on how to collect the sample. You turn in, it's basically a little card, you put a little fecal sample onto, you return to the lab, and then they run it to look for DNA markers for stool that could be with polyps or colorectal cancer. And if it comes back positive, then that's an indication that, hey, you really need to have a colonoscopy within the next 9 months.
Okay.
To go look for whatever caused that test to be positive. Now, any screening test isn't going to be perfect. Certainly things can be missed, or it can be positive and then we find nothing.
Right.
But it's we want to basically cast as wide a net as possible to get as many people in to figure out what's going on.
Okay. And we did talk a little bit about the Fit Kit and the fact that if you do choose that route, make sure you check with your insurance first to see what your coverage is, and if there is a finding, what your coverage is after that, because that is an important factor in your decision on which way to go, right? To get screened.
Correct. Yeah, we've had a lot of patients that are going for the non-invasive route. Understandably, people have concerns about sedation. No procedure comes without risk.
Right.
And certainly the colonoscopy is low risk, but it's still more risky than doing a non-invasive test.
Sure.
I will say to people, though, that any screening modality is going to be covered, but it's a question of, if you get a positive test, what is your coverage going to look like after that? So I do think it's important that people talk to their insurance before choosing one of the non-invasive routes, if that's the way they're looking to go, for if a test does come back positive.
Okay, and so before we wrap up, I want you to talk to us about anything you can do to possibly prevent colon cancer. What are some preventative measures I can take every single day with the choices that I make?
Sure. So I would say that the number one thing is getting screened at the appropriate time. So whether that's at age 45 if you're average risk, or if that's at a younger age if you have family history. Primarily, especially those people with first degree relatives, really need to be coming in sooner, whether it's at age 40 or 10 years younger than the earliest diagnosis in their first degree relative. So that's mom, dad, sisters, brothers. So if one of them has been diagnosed, it's really important that you talk with your providers. Screening is the number one thing, because what we can do is go in and remove problems before they become a bigger issue, or identify problems if they're already there. So that's what I mean when it comes to like polyps and stuff when we go to remove those, is preventing that progression. Things you can do, obviously, outside of screening, I'd say having a healthy diet is pretty important. A nice high fiber diet is critical. There's no specific diet that I tell people to go on, but generally a lot of people stick with like the Mediterranean diet, or other just general balance of fruits, vegetables, lean protein. Try to reduce your processed foods as much as possible. Certainly we've seen a rise in colorectal cancer screening over the years as processed foods have become more readily available, and that's considered to be possible risk factors for why we've been seeing that increase. So nice healthy diet, active living, active lifestyle, so making sure just the general kind of healthy things that you would normally do. But like I said, the biggest thing is just making sure you get some form of screening at the appropriate time.
Perfect. Well, thank you so much. And if you would like to learn more from Dr. Bruce, obviously you can find him at the Gastro Group and Endo Center in Covington, but he is also hosting a virtual Lunch and Learn Tuesday, March 19th. So if you want more details on that, you can go to sttammany.health, and we will have details there. And we have other screening and education opportunities that are going to be happening throughout the month of March. If you watch our Facebook pages, Healthier North Shore Facebook page, you'll learn about some resources and tips. So once again, thank you so much, Dr. Bruce, for joining us. And we will be right back with Healthy Living.
Innovative healthcare isn't just about robots. It's about people. And world-class healthcare requires a world-class team. We're constantly implementing innovative programs designed to develop and mentor the best and the brightest. We take care of our team so they can take care of you. The St. Tammany Health System team is going places, and our patients, well, they're going home.
Welcome back to Healthy Living. So we talked in the first segment about Colorectal Cancer Awareness Month, because at St. Tammany Health System, we like to talk about education, screening, and prevention. And that's what we do. So today, right now with me, I have Joy McWilliams. She is our breast imaging supervisor at our Women's Pavilion. And thank you so much for joining us today, Joy.
No problem. Thanks for having me.
No problem at all. We're glad to have you. So we have something coming up. We want to talk about the Women's Pavilion.
Sure.
For sure.
Yes.
But before we talk about that, we want to talk about something that we have coming up in early March under our kind of United in Pink umbrella. It is a ladies' night out.
Correct.
And tell people the name of the ladies' night out.
Sure. So we are hosting a ladies' night out event at the Covington Beer Garden. It's going to be Friday, March 8th from 5 to 7. And this is just going to give women an opportunity to have their baseline first screening mammogram, or if they're just due for their mammogram on our Be Well bus.
Awesome. So we're calling it, I'm just going to hold up the flyer, but we'll get a
Yes.
better picture for you. It's called Baseline Bunnies.
Yes, that's our theme, is baseline bunnies,
Yeah.
because, you know, so baseline is just a patient's first mammogram. So it's recommended for women age 40 to start having their mammogram. However, I know there's women out there who have never had a mammogram and they are over the age of 40. So we just want this event to just kind of encourage women to come out and just make their health a priority.
Yeah, and so when we talk about a baseline mammogram, you know, I have a young daughter. She's 20, and I'm starting to talk to her about her future health care and things that she'll need to do. But why is it so important to have that baseline? What's the importance of that?
Because that is the first initial imaging that you're going to have that the radiologists look at. So mammograms, you have them done yearly. So over the year, those radiologists are going to compare to all of your prior imaging. So if they see any little change in the breast tissue, it's early detection. You know, they can detect cancer or something that's abnormal early, which gives a patient more of a treatable prognosis.
Sure,
You
their
know,
outcome is
the outcome is much better. Yes,
Yeah.
yes.
Or it can be a better outcome.
Correct.
Right?
Yes, ma'am.
So even if you have your baseline mammogram,
Mm-hmm.
say that I skipped 2 years. Is that a reason for me to say, well, I don't know if I should go back and get another mammogram?
Never. Yes, it is very important to just come and just have your mammogram done yearly, even if you know, I know time slips away and people
Yes.
forget, and, you know, lots of women, we're taking care of other people in our family, but again, we gotta set back and just take care of ourselves.
Right,
Yes.
make your health a priority, really.
Yes.
Yeah. So,
And this event also gives women other opportunities for health educational and screenings. We're going to have carotid ultrasound screenings, musculoskeletal screenings, lung cancer education, and skin cancer screening and education with Dr. McDaniel.
so those are big ones because all of this, you know, your breast health is extremely important, but so is your heart health
Yes.
and your skin health
yeah.
and your lung health. And we've learned just over the past couple of years that lung cancer in women is on the rise. It's rapidly catching up to the lung cancer rates in men. So this is something, while we're not going to be able to screen you necessarily at this event, you will get education and resources on how you can get those screenings. But when we talk about carotid artery screenings, for example, that is affecting your brain and your heart. I mean, your carotid artery, that's your pathway.
Yes, ma'am.
So those will be available there as well. And skin cancer screenings, that's very important. Last year at our Women's Health event in October, we had an early catch of melanoma at this screening event. So yeah, I talked to, it's a friend of mine, talked to her the other day, and she said, yeah, I was at the ladies' night out. And I said, well, you know, I might as well have this looked at. It's been bugging me. And I have an appointment in December with my no, she found the melanoma at our event.
That's awesome.
And it was caught early.
That's awesome.
And she was treated.
I think I'm going to be in line for that too.
Yeah.
Take
And
advantage of
Look,
it.
we're going
yeah.
into spring and summer. It's a good time to kind of get everything checked out.
Absolutely.
So let's go back to the mammograms for just 1 second, because another thing we were kind of talking about is if you did just have your mammogram, say in October, you want to wait that full year, right?
Correct.
Why? Why would you
Correct.
want to wait the full year?
It's just that's what's recommended by our radiologist. So it's, you know, to make sure to have it done yearly, and just things can change within that year. If you have it too soon, you know, it's
You might
just
miss a change.
Correct.
Right.
Yes.
So when someone does, like, if you do get your mammogram and something is discovered, you know, there's a lot of things it could be, right? It's not always the worst case
It's
scenario.
not the worst case scenario.
But what would my next step be? So I get my screening mammogram on the Be Well bus at the Baseline Bunnies event.
Correct.
And they call me and say, listen, we have a finding. What are they going to tell me to do next?
So one of our nurses will kind of coordinate the patient to make an appointment at the Women's Pavilion. They would have to get a provider's order for that diagnostic imaging. But when the patient comes, they will have a diagnostic mammogram and or ultrasound to take a closer look at that finding.
Okay.
After the imaging, the radiologists look at the images the day the patient's there. So,
Right.
you know, the patient will get results that day. So the anxiety of waiting, you'll get the results that day. You know, hopefully in cases it could be just benign finding of cysts or lymph nodes or, you know, anything like that.
Sure.
But if it is something abnormal that the doctor wants to test, which would be a biopsy, again, that day we would have our nurse schedule the patient to have the biopsy.
Okay.
Now, you wouldn't have the biopsy that day,
Right.
but our nurses are they're really good at educating our patients on what they are going to have done with the biopsy.
Yeah.
Yeah.
And we can handle the biopsy at the Women's Pavilion.
Correct. We do it through mammography or ultrasound and MRI.
Yeah.
Yeah.
And we talked about this, I think, last time you were here.
Yes.
Joy joins us a lot, thank goodness, because she's a wealth of knowledge. But we talked about our stereotactic breast biopsy table, which is a newer model that we got.
Yes.
And it's increased the patient comfort, lessened patient anxiety, and sort of made the process much more efficient.
Correct. Yes.
So-
It just gives our radiologists a precise target to get to that lesion that they're trying to get at with our new table. It lessens the anxiety because the patient is lying down. You know, before we had a capability of a patient sitting up. You know, when you're sitting up, you can kind of see in your peripheral vision. So it does increase the anxiety to the patient. So lying down, they can't see anything, you know, so that does lessen the anxiety.
Yeah. And then couple that with, like you said, the caring and compassionate people that are working with you at the Women's Pavilion.
Yes.
So that's a really good combination.
Absolutely.
For a great outcome.
Absolutely.
So let's talk about if I go to my doctor, he tells me this. How do I say I want to come to the Women's Pavilion? Do I need a referral? Can I choose you? What's the
For
process?
just a screening mammogram, no. A patient does not need to have an order.
Okay.
They can call the Women's Pavilion, make that appointment, or if they have MyChart access, they can schedule the appointment as a self-referral on MyChart. You know, we are accepting or offering same-day appointments.
Oh,
We
good.
also offer screening mammogram appointments on Saturday mornings.
Oh, wow, that's convenient, especially if you're working.
Correct. And then that's what's important about these events too, is if a working mom or, you know, lady who just doesn't have the time, we have these after-hour events to have it done.
Sure. So where you're located, real quick?
We're located on Highway 190 in Covington. Address is 301 North Highway 190, Suite C2. Landmark, we're behind IHOP and Movie Tavern on 190. Yes.
So what other services besides mammograms, biopsies, anything else that we didn't cover that is
Yes.
offered there?
Correct. So we offer screening and diagnostic mammography, breast ultrasound, the breast interventional procedures. We offer MRI, bone densities, and pelvic floor therapy.
Oh, wow. Okay, so you have a whole smattering
Yes.
of things offered for women, Women's Pavilion.
Correct.
Good.
Correct.
So is there anything else you want to add that we haven't covered about the Women's Pavilion, about people at the Women's Pavilion, about
Yes.
services, anything like that?
I would just love to let patients know the quality of care they're going to get at the Women's Pavilion from our staff members. They are just professional, caring, and compassionate to our patients and our radiologists. They are breast fellowship trained radiologists, so they
wow.
are solely dedicated to breast imaging. You know, they don't perform procedures or practice medicine in any other field. So we just want patients to just feel that confidence and comfort knowing that they are getting the best quality of care in their breast health journey.
Great. Well, that is so good to know. And it gives me peace of mind because I
Yeah.
have 2 daughters, right? And I am a woman. So it gives me peace of mind that we can get that right here on the North Shore.
Correct.
Yeah.
Yes.
So we just want to mention one more time. We're going to, again, show you a better picture of this. But this is our event that's coming up. It's coming up March 8th. It's a Friday night. Get your girlfriends. Come on out to the beer garden, the Covington Beer Garden. It's from 5 to 7 p.m. We have education, resources, screening opportunities for you, and we want to see you there. So please join us. Joy, thank you so much for coming on Healthy Living and talking to us about the Women's Pavilion and all things women's health. We appreciate it.
Thank you.
And thank you for watching Healthy Living. We'll see you next time.